Moving to this story now, the Carolinas entering the peak of the flu season along with the rest of the nation. But the numbers prove it here in the Carolinas. Doctors are seeing a surge in cases and hospitalizations for respiratory illnesses. There's new numbers out that show more than 1,000 North Carolinians are in the hospital because of just the flu. Yeah, new CDC data also shows both North and South Carolina are in the very high category for spread of influenza. WCNC Charlotte's Jesse Pierre is joining us live from West Charlotte tonight. So, I mean, we're really just seeing this spread like wildfire right now in our area.
Absolutely, and doctors want folks to do whatever they can to stop the spread of these viruses. And if you are sick, you have mild symptoms, treat them with over-the-counter medication, get lots of rest, get plenty of water, and stay home.
Most people who get RSV, COVID, or the flu will recover and do fine and only be sick for a few days. But for some folks, that's not true.
RSV, COVID, and the flu remain top of mind for doctors as we approach the peak of the winter respiratory virus season, and cases continue to trend upward following the winter holidays. Some people are more at risk of getting seriously sick than others.
The folks most likely to have complications from any of these illnesses are those who are very young, very old, or people with chronic medical conditions are very likely to have complications. But even healthy people can have complications.
This flu season, North Carolina already reporting 52 flu-related deaths. South Carolina reporting 34. Several hospitals put visitor restrictions in place to protect their sickest patients. Atrium Health also expanding telehealth appointments.
Frequently, these illnesses can be managed with a video visit. The advice and the medications that need to be prescribed can be prescribed without you having to physically come into the office.
Dr. Daniel Davis with Atrium Health says hospitals are pretty full and only people who are seriously sick should go to the ER.
We don't want to pack our emergency rooms with people that don't have life-threatening illnesses because it just results in delays in your treatment, but also delays in treatments for those patients that do have those most severe illnesses that need to be seen right away.
He adds vaccination is your best defense against these viruses.
It's never too late to get your flu shot. It's never too late to get your updated COVID vaccine. The majority of people who've had severe illness, who've ended up in the hospital or who've actually died from flu this year have been unvaccinated.
Doctors say if you have a fever and it doesn't want to come down even after you've taken over-the-counter medication, if you're wheezing or having a hard time breathing, then you want to head to the ER. Live in West Charlotte, Jesse Pierre, WCNC Charlotte.
And Jesse, thanks for that reporting. And you know, parents at home, we know these rising case counts can be concerning for your little ones, especially as they head back to class after winter break. So tonight on WCNC Plus, we have a new Mom Squad special all about illness. We're going to hear from a pediatric specialist about what symptoms to watch for and when it is necessary to go to the doctor. And you can turn this on at 8 o'clock. WCNC Plus, once again, that is available on your favorite streaming device.